Hi, my name is Radiya Amin, and my presentation is on vitiligo. What exactly is vitiligo? Well, vitiligo is often considered an autoimmune disease. This autoimmune disease causes people to lose patches of pigment in their skin. Discoloration first shows on sun-exposed areas such as our hands, feet, lips, arms, and our face. The condition is photosensitive. This just means that the affected areas are more sensitive to the sun. There are two types of vitiligo. There's non-segmental and segmental. The non-segmental are white symmetrical patches. They're the most common type. They make about 90% of our cases. They develop a lot slower. They appear on skin, most commonly exposed to the sun. Our segmental, however, is the exact opposite. Segmental is non-symmetrical. It spreads rapidly, but it is less common. It affects only 10% of our cases. It usually affects areas of the skin attached to the nerves arising in the dorsal roots of our spine. What does vitiligo look like? Well, in this photo, I have a male model and a female model. The male model has segmental vitiligo, and the female has non-segmental vitiligo. The symptoms of vitiligo include patchy loss of skin color, premature whitening, graying of the scalp, eyelashes, beard, or eyebrows. There's a loss of color in the tissue lining in the inside of our mouth, loss or change in color of the inner layer of our eyeball, which is the retina, and the causes. Pigment-producing cells, which is melanocytes, die or stop producing melanin, the pigment that gives your skin, hair, and eyes color. Doctors don't know the exact reason this happens, but they have evaluated that it may be related to trigger events, such as stress or sunburn, autoimmune diseases, family history, such as genetics, and exposure to certain chemicals. What causes vitiligo? Well, in this photo, I just have an example of what causes vitiligo. It's the absence of melanin, and then on the hand we have disappearance of melanocytes and the interruption to produce melanin. Complications. People with vitiligo may have an increased risk of painful sunburn, hearing loss, eye problems such as inflammation of the iris, social or psychological distress. Treatments. This can't be cured, but it can be managed. It can be managed through medication, tropical steroids, and light therapy. Surgery is another option, but surgery won't cure it. It'll just even out the skin tone that was damaged. If you do decide on surgery, you have the options of skin grafting, blister grafting, and tattooing. So it's not a cure, and it may even trigger another event of vitiligo. Potential treatments. Treatments that are being studied include a drug that will stimulate color-producing cells, a drug that reverses loss of color, and a drug that helps control melanocytes. Here are my references.